Hello, everyone. Welcome back. We are having a new conversation with a new friend. So, Bissan, thank you so much for being here with me today.
You're welcome, Ira. My pleasure, actually.
So, if you are new to the conversation, all this is just allowing people to share their stories about their health journey and how they have used functional medicine along the way. So, before we get to your health journey, Bisan, tell us a little bit about who you are, where you're from, and what you do.
Okay, so my name is Bissan. I live in sunny Florida. I love the hot weather and the beaches. I am originally from Lebanon, hence the accent. I have been here 20 years. It didn't go away yet. So I'm a biochemist. I have a master's degree in biotechnology, and I worked in the hair loss industry for 10 years. And I studied something called trichology. I'm not know if you're familiar with that term. Trichology is the science of hair, and I studied hair loss conditions and scalp disorders. And then I decided to complement that trichology with functional medicine health coaching. So I signed up. I just graduated from the functional medicine health coaching academy. Yay! I am fresh graduate right now, and and I am trying to figure out ways to incorporate the coaching process into our hair loss clients in a way. So I'm working on that now.
Wow, that is so cool. Well, first of all, congratulations
Thank
on
you.
completing the program. I've gone through the same program and I know how amazing it is, but also challenging as well.
Yes.
And so, yeah, good for you for getting it done. And now you get to use all of that knowledge and those skills that you've built to kind of complement what you've already been doing. So that's really, really cool.
Yes, I figured out that health coaching, and I like all this year, is just amazing how it's instilled in my head that these tools are great for any industry,
Hmm.
So now I'm just putting it as a big plan together.
Yeah, yeah. In my cohort, we had people from different backgrounds,
Mhm.
different work backgrounds. We had, people who worked for the government. We had a lawyer. We had a nurse. I'm a professor by trade. So
Yeah,
yeah, any
nice.
any area
Yep.
of career or whatever you're doing. I've even found that coaching has helped me as a mom at
Thank
certain
you.
times.
Yes. Yes.
Yeah,
100%. Thank you. Yep.
yeah,
100%. It
cool.
helped me a lot.
So let's turn our attention to your health journey. So let's talk a little bit about what kinds of things were you noticing personally that were off, that kind of were like the signals, yeah, I need to get this looked at and checked out.
Okay. So I'll tell you my story shortly. It's a bit dramatic, but here I am, great and healthy. So back in 2018, I had a very big life traumatic event that happened. Um, so basically, it started long time before 2018, but it's amazing. At 2018, when it stopped, you know
Hmm.
how we say that the body keeps the score?
Hmm.
So when it ended, basically, this very bad event that happened, my body started to, was like, okay, now it's my turn. I served you on adrenaline and coffee for so long.
Yeah.
Now it is my turn to heal, relax, and heal. So I
Hmm.
started noticing bad breath, bloating, like like pain in my abdomen. It was so weird. I started to be weak. I work out a lot, and now it's like I can't even run. I start to feel fatigued all the time, and I didn't understand what is going on. But my bad breath was the thing that made me. It's like there's something wrong. Either maybe it's my teeth. So I went
Hmm.
to a dentist and I checked everything is okay. Okay, so maybe it's my stomach. I went to a GI doctor And she was a lady. I still remember her a lot, still remember her face. I told her, I have bad breath. She's like, what? I was like, yeah, it's really annoying. It's bad breath. And I do work with patients very closely.
Mm-hmm.
And she's like, do you brush your teeth? I was like, yes, ma'am, I do brush my teeth. Not my teeth, it's something else. And I went to the dentist. She's like, looked around my mouth, looked around my throat, wherever she did, like just from outside. And
Mm-hmm.
she laughed at me and she's like, go home, you're fine.
Mm.
And she's like, who tells you who you have a bad breath? I said, my boyfriend at the time. It's like, my boyfriend keeps saying that and it's embarrassing. And this,
Mm-hmm.
tell your boyfriend is nothing to worry about. Go. I was like, okay. It didn't resonate well with me. I booked
Yeah.
another appointment with another GI. And I said, I have these symptoms, like it's pain, not only bad breath. Doctor, there's pain. Something is wrong in my abdomen.
Mm-hmm.
So we went through an endoscopy. It's a very painful procedure. Looked around everything. He's like, you're good. Your stomach looks good. Your intestine looks good. Take Tums.
Mm,
Like, okay, Tums. I take Tums. It doesn't do anything. I went to
right.
the third GI doctor. The third GI doctor was straight to the point. He's like, oh, you have high acidity just from me talking. He never touched me or did any exam. He's like,
Mm-hmm.
um, you need the proton inhibitor, what's called Prolozac something.
Yeah.
Go take it. I was like, okay, maybe I do have high acidity. Who knows? I took the Prolozac for a month, and the bloating, the food I will be eating food, it will stay in my stomach and never leaves. Like
Mm-hmm.
I will eat a chicken salad for lunch. Halfway through my chicken salad at work, I will be so full, but I didn't feel that I ate enough.
Mm-hmm.
6 p.m. at night, I go home, the food is still there,
Mm-hmm.
and I have like this big belly, but like I am hungry. I am
Mm.
dizzy. I'm like lightheaded. I need to eat, but I can't eat. Every time I eat, I feel worse and worse and worse. So this took like a long time until I said, maybe I should go see a natural doctor. I went to an acupuncturist. I went to this acupuncturist and I was like crying in his office. I think I
Mm-hmm.
overwhelmed him too. I was crying. I was like, I can't sleep. I'm having insomnia right now. I can't sleep. I'm tired, brain fog, all these symptoms. And he's like, okay, lay on this bed and I'll put all these needles. It's like, I know you are an acupuncturist doctor, but I can't relax. I am anxious.
Mm-hmm.
I am nervous. I'm overwhelmed. And he's like, no, 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 you just try to relax. I try to relax. I just can't relax.
Mm-hmm.
And then I went out of his office with, he didn't even ask me what's going on. He's like, relax on the chair. I could not relax. And actually,
Mm-hmm.
I cut my session short and I left because I'm not here to relax. I can't relax.
Yeah.
I'm
Yeah.
so tired. I'm
You
over.
need relief at this point. You just need relief.
Somebody talk to me. So
Yeah.
anyway, on my way that week, maybe I was hearing a podcast, and it was interview with Dr. Mark Hyman. He
Mm.
was talking about functional medicine, and he was telling us in the podcast about how functional medicine looks at the root cause and all the try to see what caused your symptoms, and we go forward from there. It's like, huh,
Mm-hmm.
that is speaking to me. I listened, so I went to the podcast and subscribed to his channel, and I start listening, listening, listening. And amazing, it's just this functional medicine thing is speaking to me. Yes.
Mm.
And he was saying that like bloating, like he was talking about bloating and fatigue and gas in one of the episodes. It's like, oh my God, that's me. What he is talking about it. And so there's a lot of other people that have the same symptom.
Mm-hmm.
uh, it's not me alone. I am not a baby. I went to 3 doctors, 4 doctors, and they told me to go home. So
Mm-hmm.
what I am experiencing is real, and it is, I mean, it's like debilitating. I can't sleep, I can't work. So anyway, to cut the story short, through my podcast and my research and started understanding what's functional medicine, I understood that there's a problem with the digestive system inside my body. So I started taking digestive enzymes. I started taking betaine HCl, started to feel a little bit relief. But what happened is so that took me 6 months actually until I reached to that point. So 6 months of not digesting my food properly and insomnia and all the other symptoms, the fatigue, the brain fog, the digestive enzymes, I would say, helped 50% because I was feeling a little bit better. The bowels are moving. I eat a little bit better. But there is a lot of things still that when I eat them, it irritates me. And still the brain fog there, the insomnia, I didn't solve it properly. Sometimes I sleep, sometimes I don't. I got depressed at that point because of all the neurotransmitters are not functioning well. So I finally decided it's time for a functional medicine doctor to help me through this. I called the functional medicine doctor, and unfortunately, it was the starting of the pandemic at this point. So it was a Zoom meeting in a way.
Wow. So you were going through this for well over a year and a half before you even saw a functional medicine practitioner.
It took me 6 months on just to find what functional medicine is. It took me another year to understand what functional medicine, and I tried the digestive enzymes. It got relief a little bit, so I thought I'm good, but I didn't understand the depth of the problem.
Yeah.
So for 6 months I felt good. So okay, I'll be good, better by time. But I did not understand the ramifications of undigested food in my stomach for that long. I didn't understand how it's going to affect my sleep, my brain function. I got depressed.
Yeah.
So
I want to ask you something. I want to go back to what you started with this stressful, traumatic event that happened. How do you think that played a part in kind of was it, the catalyst that really kind of kicked off what had been building up for a time?
Yes, because I went to a 3 GI specialist. I'm a biologist, so I can understand I'm in the healthcare industry. So when I go, I know something is wrong in my stomach. I went to 3 specialists, and 3 of them dismissed me. One of them laughed at me. And I went to a natural doctor. I understand there's alternative medicine. And he still did not understand why I'm there. He thought I'm there for a session, which is, I understand it's his profession, but maybe I went to the wrong person. I don't know. So all this, it kept me thinking. I was like, what is going on? Why no doctor is listening to what I'm saying?
Yeah.
I don't get it. Like when I say brain fog at my age, I was 40 at the time. When I say brain fog, it's not normal. And I do scalp micropigmentation, which is like a tattoo on people's head to give them fullness. So my work is very it's very precise. So I'm having a needle on a person's head, and I am drawing all these hair follicles. They have to be so precise. I cannot afford to have brain fog. I cannot. And I cannot be lightheaded or dizzy during my work hours. I need to be fully functional. And that's why I invested so much in research. I will go home and read and read and read. And I tried 5-HTP for my depression. I started to do smoothies at home just to give me power and energy because I know I can't eat. Isn't that bad?
Yeah, that, it really sounds like you went through the ringer just with trying to figure out, obviously going to the people who are supposed to be the professionals, who are supposed to be helping you, but then just saying, okay, nobody's helping me. I've got to I've got to do something,
Yeah.
right? I'm going to do this on my own. And, I think a few things that I think people can take away from at least this part of your story is one, stress plays a much bigger role in our short and long-term health than I think people realize. You may have had other things going on before this traumatic event, but when it happened, it was like the spark that lit the fire. And after that, you were just having a raging inferno in your body that no one could figure out how to put out. I think something else we can take away is, the importance of self-advocacy. You went to certain practitioners, you were asking questions, and you never gave up. You didn't resolve that this was going to be your life, right? You didn't just say, well, this seems to be just a thing and I'm just going to have to deal with it. And so I think, people really need to understand that they've got to keep digging. They've got to advocate for themselves. They've got to keep asking the questions, seeking the information, because it is out there. Help is available.
Yes, exactly. Well said, actually, well said.
Yeah.
And I couldn't, as you said, I couldn't just give up and say that's it. I need I need to be functional at my work. I need to function at my life. And I mean, luckily, I have my boyfriend at the time. He is now my husband. Is a very supportive person. So he kept me strong through this. It was debilitating. One time he told me, he still reminds me, is at nights I will be punching the pillow because I am so tired, but I can't get myself to sleep. And I tried valerian root. I tried all kind of supplements. Some will work for 2, 3 days and then it will stop and I have to. So like all this, like literally from like early 2019 till the pandemic, I was just trying supplements. The amount of money I spent is unbelievable because when I buy a supplement, it doesn't work. I stop. I go buy another one, and so on. So it was a not fun time. But I want to add one thing to our viewers too. What happened is I feel what happened is like we get for a long period of stress, and when that stress stops, your body will collapse. So we sometimes when we are going through the trauma, we work on our adrenaline. It's just pushing us through. But when it stops, then everything else comes back on. So anyway, so basically, I found this functional medicine doctor. She was pretty new, and functional medicine was still taking off too. So I told her my story and everything. She was amazing girl, and she did is she said let's do she said that I think you have a SIBO, which is overgrowth of bacteria, small intestinal overgrowth of bacteria. And I was the first time in my life ever heard this term. Right? SIBO. Huh? Okay. And she said we should do the elimination diet. So she sent me through the mail, since it's the pandemic, this very thick, the elimination diet. Now I know, but at that point, she sent me a file, that thick of a file, has my timeline and has all the things that she wrote. And then I received that elimination diet. I looked and I was telling in my head, it's like, why people think I can actually read and understand what's going on? What is that she wants me to do? And I was like, look, that's too much of information. I set it aside. I did not understand that I wasn't informed properly. Let's say it that way. I wasn't informed properly. So anyway, at that time, where I was, So after the elimination diet, I wrote some notes. Oh, after the elimination diet, I called her and I said, I can't do this. I don't understand it properly. So she said, let's do a round of antibiotics because we did the SIBO test. I'm sorry, before that, we did the SIBO test with the breathing test,
Mm-hmm.
and it came out very, very high in the methane level and the hydrogen level. So
Mm-hmm.
she said that is really high off the charts number. And she did like also some blood tests. She said also you have a massive nutrient deficiencies in your body because of
Yeah.
all this, a year and a half already or two by now. Like my body is not getting any nutrients. She said that I'm gonna put you on a 2 weeks antibiotic course because nothing that can help you. The amount of bacteria in my stomach is way too high. It needs a Western medical intervention. I said, sure, okay, we'll do that. I took the antibiotics for 2 weeks. And what happened is after the antibiotics, because for the past year and a half and two, my body's been weak, my body's going through this trauma, my body couldn't handle the antibiotics. I started to have something called trichodenia, where my hair follicles are painful. I will be like doing that to my head. It's painful because my body is not handling. I lost
Mm-hmm.
I lost my power 100%. I stayed home for 2 weeks. I could not move when like after that. It was a very debilitating experience.
Mm-hmm.
Um, so what happened is I said, I mean, this functional medicine doctor helped me. I like one step further, but from now on, I need to be on top of my journey. So I started researching more, and I did found this stool test where actually I heard it on a podcast. There's a stool test where they analyze all their bacteria, and they will give you the probiotics and prebiotics that is customized to your gut health.
Mm-hmm.
So I ordered the stool test, and also I ordered a food sensitivity test because I realized, without knowing what food journal is or what is that functional medicine thing, just I realized every time I eat certain foods, for example, onions, my stomach, my husband will be looking at me, it's like, you look like 4 months pregnant. My stomach will be so bloated. Like if I eat broccoli, if I eat like certain foods, like I will bloat so much. I ordered food sensitivities. At that time, I have been in research for at least a year and a half, just me researching. And of course, I took a lot of advices from this functional medicine doctor too. I did the stool test, and it came out that I am sensitive to everything I eat. And I understood that at that time, that all this time where I am not digesting my food properly, what happened is I got something called leaky gut, where my gut start, because everything I eat, it turns into toxins. My body is not absorbing it, and it stays there, ferment over there, and then my body thinks it's the enemy, instead of
Mm-hmm.
treating it as food and absorb it properly. My bloodstream was full of toxins. My immunity levels were so low. It was a disaster anyway.
Yeah.
It was a
So your
disaster.
body's dealing with so many different issues all at one time.
So the thing that I want to also simplify to the audience, it started with undigested food. Because I couldn't tackle it, nobody could tackle it at that point when I went to the 3 doctors, GI doctors. It was a very small issue. I have undigested food in my stomach. 2 years later, it ended up with a nightmare. It
Mm-hmm.
ended up with food sensitivities to every single thing I eat. Even it was a strawberry. Oh, I was sensitive to cucumbers. Believe it or not,
Wow.
cucumbers. Like, and I like, uh, it's just insane. The amount of list of the food sensitivity that came back, it's just like, what can I eat? The only
Mm-hmm.
thing I can eat is bone broth, plain rice, and plain chicken or plain protein, not red meat, just plain chicken or turkey. It was like, it's crazy. How I'm gonna live like that? It's just crazy. But anyway, that was my only option. I said, that's my last resort. I'm gonna do it. For 6 months after that, probiotics, prebiotics, eating, I swear to you, I will wake up in the morning and my breakfast will be plain rice. I have to. Then
Wow.
it's just, I eat rice and chicken breakfast and lunch and dinner. That's my only, and I didn't care because I was fed up, fed up, fed up. It was my only resort. Otherwise, I'm just gonna, I don't know, maybe I'll be in a hospital one day. So for 6 months, I started to regain little bit my energy, my power. I started to feel more better in terms of bloating. Then I started to introduce, and at that point, nobody told me about introducing food again, but it's maybe an intuition or something. I started, okay, let me try today to eat different than rice, little bit by little bit. Then I did the stool test again, and my food sensitivity list decreased. My okay to eat list increased, and so on until now I feel 80% better, and that is 5 years later.
Wow.
It could have been just 6 weeks of good care.
Yeah.
5 years later, I still struggle with my sleep a little bit, but I know what to take at what time to take it. Now I know what foods I should not have, and I do my stools test and food sensitivities every 6 months to track myself, and it is expensive. But this I am adamant that I'm gonna fix this. And now I am thankfully and like I'm so grateful that I am 80% better. My brain fog is 80% gone. My sleep is 80% better. I eat almost everything except for garlic, onion, broccoli, and Brussels sprouts, which is I can live without them. That's fine. It's okay. And I want to say at the end is this 5 years journey was so hard on me, but it gave me a lot of strength and resilience and determination. But also it didn't end up here. Now I still have some issues to work with. This is what I'm trying to say is our bodies are amazing. It can heal itself, but it needs time and a lot of energy to heal itself, right? Like after this 5 years, what happened is started with this undigested food. I now, after 5 years of healing myself, I still have very low HRV, which is heart rate variability. I think due to some food sensitivities at points. So I'm still dealing with that. And also I am dealing with some insomnia here and there, but it's not a big deal, it's compared to what happened before.
Yeah.
And my next thing to try to understand is I think all this stress and trauma caused some kind of insulin resistance. So my fasting glucose level is higher than the functional medicine optimal levels. It's like it's 100, 102, which is, I told my, I knew the answer, but I told my general doctor, I said, it's 102. Do you think we can do something about it? He's like, you're good. And I smiled, I swear, I smiled. I said,
Yeah.
okay, no worries. I'm not here for that.
Yeah. Yeah.
I'm not here
Yeah.
for that. But that is the end, basically. This is my next healing journey will be to figure out the insulin resistant part and to optimize my sleep and to figure out the HRV part too.
Yeah. That's amazing. I mean, you definitely have been on quite the journey of self-discovery. And it has clearly made you more self-aware of what works for you, what doesn't work for you, right? And all the different things. So now you can utilize that, not even just for yourself, but for your clients,
Yes,
right?
100%. 100%.
Yeah. Yeah. So how would you say that this health journey you've been on um, is going to affect, or maybe has affected, your coaching.
100%. So I believe 100% in functional medicine. I mean, you obviously, the story tells me that. Uh, basically, when I start reading about health coaching, in one of the podcasts, I didn't know health coaching existed, right? In one of the podcasts that I keep listening to, I realized, yes, every functional medicine doctor needs a health coach, because from my own experience, my functional medicine doctor was nice, was great. She knew what she was doing, but I was a sick, overwhelmed, brain fogged lady who will not read a booklet of elimination diet. Will not. But if
Yeah.
at that point she had a health coach, which explained it to me in in our sessions, how we explain elimination diet nice and easy, and we take the patient or the client one bit at a time. If somebody did that to me, I wouldn't reach to that point. The thing that, like, whenever something is wrong with our bodies, it starts small. Please don't ignore it. I started with undigested food, for God's sakes. All what it needed at that point, if I knew there's something called digestive enzymes or HCl, if I tackle it that and there and then, 6 weeks I will be done.
Mm-hmm.
People should not feel it is okay to leave one thing unsolved or unresolved. 5 years later, I am dealing with what much bigger problems than digestive enzymes.
Yeah.
Right? That's what I'm trying to tell. Like, that's what I'm hoping to tell your audience. Even if you have simple thing, go and resolve it.
Mm-hmm.
And that's also one of the reasons I wanted to be a health coach, because now it's like, why somebody who has undigestive uh, problem and like food in the GI tract has to spend that much money, do that much trial and error, wait 5 years, deal with massive things. Why? Why? It's unnecessary.
Right. Yeah.
So that's
Doesn't
why
make very
I'm a
much
health
sense at all.
That's why I'm a health coach. I want to go there and say, oh, you have hair loss issue? I want to talk to you about your digestive system. Do you have
Mm-hmm.
bloating? I want to talk to you before it goes nuts.
Yeah. Yeah. What would you say was something you noticed about your initial conversation with the functional medicine practitioner? Like when you sat down to talk with her, and I believe you said it was via
With
Zoom
Zoom.
at that
Yeah.
point,
Which,
right? But
which,
when you sat down to talk with her, what was something or some things that stood out to you about that
yeah.
conversation?
Yes, that's why I also am grateful for her. Even we didn't finish the journey together, but I'm very grateful for her. She sat down and talked to me. She talked to me for 1 hour and she was writing notes.
Mm-hmm.
And after this initial session with her, I felt so much relief. She didn't give me a pill or anything. She just listened to my story. And she agreed to my story. She said, yes, this happens, and it might be this, and it might be that. I was like, oh my God, why 3 GI doctors didn't even think about something called SIBO? I mean, isn't that a medical thing or what? It's just like, it blows my mind. But my relationship with her, because she listened, I
Mm-hmm.
was so much relieved. I actually, just by her listening, I think it improved my health 20%. Believe me, if she has a health coach to coach me through the elimination diet, it will be set and done at that point. Believe me.
Yeah.
Um, but it's not. It's my mistake. I didn't take the time to read the elimination diet anyway.
Mm-hmm. Mm-hmm.
Yeah. But no,
That is a big part of the process, is being able to connect with your practitioner.
Yes, 100%.
And to know that they are there for you. It's very empowering. It kind of lifts you up a little bit, gives you some hope, and gives you some options on how to potentially move forward. I think that's a really cool thing about health
Right.
coaches is that we are there to listen. We are there to empower. We don't want you to be dependent on us, right? You go through your sessions, however long that might be, but at some point we want you to we want you to have the tools to have the understanding to do things on your own, and not have to be totally tied to um, the coach, the practitioner, whatever. So, yeah, that component of active
Mhm.
listening
Right.
and showing empathy and recognizing, something is going on,
Yeah.
right? Is huge.
Yeah. Don't forget that at like clients or patients at that point, I was overwhelmed,
Mm,
right? I was so overwhelmed. It's amazing that everybody will talk to me. I cry. So when the functional medicine doctor sat down and listened to my story for 1 hour,
Mm-hmm.
that alone is worth a lot. That
Mm-hmm.
alone is worth a lot. And her checking up on me. How you feeling? What's going on? How you feeling? That alone is worth a lot. So and also I feel that health coaches, since clients or patients are so overwhelmed, if you just simplify things for them, they
Mm-hmm.
will appreciate it. They should do the work, of course, but by saying elimination diet definition, make it simple without them having to read big at that point because they're so overwhelmed. It will help or entice them to go and read more, because
Mm-hmm.
obviously we want to, like, no, we want to have a solution. We want to know what is the solution, but we want somebody to direct us. It's worth reading. Go read it. You
Mm-hmm.
know?
yeah, yeah. And I do appreciate that because I think, once, at least for me personally, once I started learning and reading and talking to people and asking questions and hearing the podcast, it was like I can't get enough information now.
Exactly.
I ask more questions, I talk to more people. It just has become something that is the norm for me. But it starts with just a little bit, right? Just a little bit, something simple. And I think that's really important to remember in terms of the action you take as well, right? You don't have to start with everything. Start with one thing. What can you do today? Is it walking, 10 minutes? Is it adding, a vegetable a week? Whatever it is for you, just start simple. Start with that one step. It can really make for a very powerful experience and, long term, a big change.
Right. Like now, my mission is, after I went through all this, and I'm still recovering in a way.
Mm-hmm.
Uh, I, like any family member or any friend who are dealing with something. Now I learned not to give advice, but I used to. Oh my God, I used to give advice all the time, and I wonder, like, you're suffering. Why are you not taking the vitamin I told you to take? I was like, when I went through the course, I was like, oh, that's
Mm-hmm.
why they should decide themselves to
Mm-hmm.
take it, and we push them towards. Oh my God, I'm so grateful for this coaching year I went through. It's just lighting up a lot of light bulbs in my head. But
Yeah.
my mission now, I want to tell people who are suffering from, especially women, we are so how do you say that, we think we're very strong, and moms with brain fog, walking with hair loss issues, and they say it's okay, no problem, I can take it.
Mm-hmm.
I'll drink more cup of coffee, I'll drink,
Mm-hmm.
I'll push through. What I want to just tell them, don't do that, because if you don't take care of your body, of your soul, then you won't be able to take care of the people around you. And I really want, like, my mission is to help my community, my friends, my family, to just understand the power of functional medicine. Functional medicine is not only a medicine, it's a way of living, it's a lifestyle. It's you deserve to sleep better. You deserve to eat good food. Your body deserves that, and it
Mhm.
feeds your soul, it feeds your mind. And when you do that, I glow when I take care of myself. And when I glow, I help everybody around me.
Yeah.
I, like you fill your cup and you still start filling the cups of everybody around you. Like
Yeah.
that's my mission. And I'm so grateful that I reached to this point in my life. Because if I look back, all the trauma that I went through, I was angry and I was like living on coffee. I was living on like my adrenaline level will be so high. If I look at my pictures before, I was like so skinny. My eyeballs were inside,
Mm-hmm.
and I was just pushing through until my body told me enough is enough.
Mm-hmm.
Yeah.
So my body slowed me down and told me. And I want to tell other audience, don't wait to that point. It is so hard when you go that point.
Yeah.
Slow
Yeah.
down, take it easy. Life is worth it.
Yeah. Absolutely. Well, Bisan, I appreciate you taking the time to so candidly and passionately tell your story. I think those that are watching are going to take away some really good nuggets of information and be inspired by your journey. So, thank you for being with me today.
Oh, you're welcome. And I hope that I inspired somebody, only one person, to go take care of themselves.
Yeah, yeah. So if people want to connect with you or maybe they have questions for you, where can they find you?
Well, I am still working on my website, but hopefully my website will be called Health and Wellness by Bissan. And for now, just if they reach out for my Facebook page, Bissan Depsi, which is my name, I will be welcoming everybody because I did not set up for my proper business yet because
Mm-hmm.
I just graduated and I am going through the process right now. But I will be advertising everything on my Facebook page so people can follow me and follow what is gonna come next.
Awesome. Well, I will make sure to put your name and everything in the description for the show so they can connect with you
Thank you.
and follow along on your journey.
Yes, thank you.
So, for those of you that are watching or listening, um, thank you so much for being with us today. Make sure that you like the episode and subscribe to the channel so you don't miss any of the convos. And until next time, I'll see you. Bye.